I'm Dr. George Flinn. Thank you for joining us for In-Depth TV. We've got a very special segment for you today, and we want to thank Mike Daly and TCT Network for allowing us to have this very important message. And Dr. Dagogo-Jack actually came up with the idea and has been very good at organizing it. So Dr. Dagogo-Jack, wave your hand so everybody knows who you are.
Hello.
And Dr. Claudette Shephard is on with audio with us. Say hello. She's muted. And Dr. Latonya Washington,
She
president of
said
Bluff
that
City Medical
she was.
Society, is with us. Thank you.
Hi, everyone.
And Dr. Persico Wofford is with us also. We really
Good morning.
appreciate all of this expertise. And then I think we should just dive right into the subject because we're talking about COVID, we're talking about vaccinations, and this is extremely important. And I'm going to ask Dr. Dagogo-Jack to talk just a little bit about the seriousness of COVID-19 and possibility of vaccination.
Thank you, Dr. Flinn, and thank you, my colleagues, for logging on to discuss this extremely important matter. COVID is a massively serious pandemic, once in a millennium pandemic. Over 100 million souls tested positive globally, nearly 27 million positive in the US, nearly 500,000 deaths. At one time, we were losing daily the equivalent of a 9/11 disaster, massive disruption to the order of the world, to education, to travel, to businesses. So no one should be in doubt that this is an extremely serious global problem that requires a serious approach.
Is there, please remind people about mitigation, mask wearing. Should you wear a mask? Should you not wear a mask? Should you social distance anymore? Should you not? What is going on there?
Sure, the Centers for Disease Control, back in the spring when this problem started rearing its head, came up with very good public health measures. After we had evidence that masking protects not just you, but others around you from catching it. And then there was also a recommendation that if you needed to cough or sneeze, do it into your elbow instead of spreading it around. And then wash your hands frequently, and each time with soap and under the tap, washing the hands and counting to 20, so at least 20 seconds to get rid of any surface dwelling virus particles. Then as much as possible, avoid crowds, congregate settings, and then get tested if you have any symptoms, or even if you do not, but believe you've been exposed, and limit outside activities that expose you to people. And these sanitary measures are proven public health strategies to decrease transmission of the virus from person to person.
I'm going to throw a curveball here to Dr. Washington. As president of Bluff City Medical Society, do you see in the general community, are people obeying the masking? Are they obeying the social distancing? What challenges do you see that we have there? Or if they're all doing it fine, or if they're not? And what do you think?
So I've certainly seen increased mask compliance over the past several months. Initially, in the early spring of 2020, we were seeing a lot of people that weren't wearing masks, or if they were wearing them, they weren't wearing them appropriately. At this time, I'm seeing most people that are out and about, they are wearing their mask appropriately. We know that appropriate mask wear means that you are covering both your nose and your mouth completely.
Right. This is half
a mask,
Don't
exactly.
do this.
Right, and a mask as a chin strap is not useful for the wearer or for people who are around that
like
person.
That. Yeah.
So I have seen that most people are fairly compliant with mask wearing. As far as the social distancing, I have seen that lax over time. I am seeing people really kind of congregate into crowds. They're being out and about, kind of getting back to normal life. And my concern with that is that that is certainly increasing the risk for exposure. And so we certainly want to be cautious about that. I personally have limited my exposures. I actually went to a restaurant on yesterday for the first time, probably in about 8 or 9 months, but I was not very comfortable there. So I don't think I will be going back to a restaurant anytime soon. It's very important that we continue to do all of these mitigating factors, wearing masks, even though probably most of us on this call have been vaccinated. It is still important that we do that to protect those around us as well.
Well, Dr. Wofford, tell us about the medical. You see patients with a lot of other conditions, outlying conditions, and concomitant conditions. What do you think, pre-existing thing? What give us the medical perspective of COVID-19 and vaccination and that kind of thing?
COVID-19 is like Dr. Dagogo-Jack said, a once in a millennium pandemic, and it's affected millions of people, and it will continue to affect people unless we change. We, as the populace in general, change. I, as a kidney specialist, is in one of the groups of physicians intimately involved in treatment of these patients because, unfortunately, this virus has a predilection for the kidneys and the lungs. So I see a lot of patients with acute respiratory failure and kidney failure. And some require dialysis when it's appropriate, and some require or get better on their own, even though I see them, and some will succumb, whether from the lung disease or kidney disease, to this terrible disease. Uh, it is real. It's starting to decline. The hospitalization has started to decline, but it's a very devastating disease. Uh, as you know, patients, and according to the CDC, and they got good evidence that patients who are over 75 have a higher mortality. Then they got grouped in patients over 65. And as you stated, patients with other comorbidities, diabetes, hypertension, obesity, other underlying health conditions are at increased risk from more moderate to severe disease, and also hospitalization and death. So that's why we and Dr. Dagogo-Jack has did an excellent job trying to relay the mitigating factors that we know that we can use, some simple things that we can use to kind of combat this uh, terrible pandemic. In regards to your question about the vaccinations, I think Operation Warp Speed has provided a great outline, and there's a supply in each state, and it's up to the states and their state health departments to make their rankings or lists as outlined, as we already know, 1A, 1B, about who should get vaccinated, and first responders, ICU, ER, paramedics, the sanitation, environmental services workers, anybody dealing with the patient should be first in line. And by most part, they were. And the first batch, as you know, of vaccination was given to the hospitals because Pfizer vaccine required this extreme refrigeration. And then now the Moderna is available. And now the Johnson & Johnson vaccine, as you have seen already, 66% effective against moderate and at least moderate disease, and 85% against the most severe forms of the disease. And that's being going to be reviewed by the FDA, and hopefully it's reviewed and successfully passed, and hope we have more vaccines available.
J&J was just released today, as a matter of fact. But going on with that, there's a sense that certain groups are more susceptible and fare worse with COVID-19. I'd like for Dr. Washington to discuss that, about the racial and ethnic patterns, and then following on with that, to follow up with Dr. Dagogo-Jack, discussing the pre-existing conditions and how serious they can make COVID-19. Go ahead, Dr. Washington.
Yeah, I'd like to just kind of circle back and discuss what Dr. Wofford said. He referred to the operation to get the COVID vaccine, the Operation Warp Speed. And so I would argue that that really wasn't the best terminology to use. for that campaign to get the vaccine approved. But do understand that although it was called warp speed, that does not mean that corners were cut and that the vaccine is not safe. So I'd just like to interject and include that. So warp speed was not the best naming of the operation to get this COVID vaccine released. We knew that we did have a need for the vaccine to be produced quickly. The federal government did allow the funding and resources to be able to do that in a very quick fashion, but no corners were cut from the scientific process. All of the steps were carried out. And so I will just leave that at that. And I know that all of us on this program are very confident that it was done in a safe manner. And so to transition over to information about COVID and affecting particular racial or ethnic minority groups, we have seen that African Americans are more adversely affected by COVID disease. Also, people who are Hispanic or Latino. We know that that population of patients also tends to have more chronic conditions. They may be adversely affected by obesity, kidney disease, like Dr. Wofford mentioned, diabetes, sleep apnea, COPD. A number of conditions have shown to cause increased risk for severe COVID disease. And so we're very concerned about those populations. When we look at the numbers for Memphis, we know that in Memphis currently about 56% of the COVID deaths are attributed to African Americans. And in Shelby County, the population is about 50% African American. And so we certainly have some concerns there. When we talk about the Hispanic and Latino community, the death rate in that population is about 17%. We think that there may be some abnormalities in regards to the amount of the population of Latino people, because when we look at the census data, it says that there are about only 6% Hispanic or Latino patients in Shelby County. And so if they're also being affected adversely, almost double their population in the community. And so we have concerns there.
Well, I looked at the Shelby County early vaccine data, and 52% of people that were vaccinated were white and 24% African American. Dr. Dagogo-Jack, what are the pre-existing conditions, and why is it so important to have the vaccine?
Thank you, Dr. Flinn. As Dr. Wofford mentioned, certain conditions like kidney disease, diabetes, chronic lung disease, COPD, conditions that decrease the resistance of the individual to fight off viruses and diseases, hypertension, heart disease, all of these conditions appear to synergize or increase the risks that an infection with COVID wreaks on the systems. And so recovery is delayed, fatality is increased, the risk of severe disease requiring ventilation support, hospitalization, ICU, all of those are markedly increased in people who have those pre-existing conditions. And among the ethnicities, we must also include Native Americans because their rates are higher, both for catching the COVID and for suffering severely from it. So these conditions therefore give us a roadmap as to who to better target preventative and mitigation measures. And when vaccinations become widely available, these vulnerable individuals must be given priority in targeting the vaccine so that they get protected, since they suffer more and have much worse outcomes from the disease.
Okay, and first, then we're by raising your hand, has everyone on the panel gotten the vaccine? I have.
I have. 2 doses.
I have.
So we have everybody that's gotten the vaccine. Well, I would like for
I have too.
I figured Dr. Shephard would come in, and I'm so glad you're here. Everyone is taking time out of work. Dr. Shephard had some pressing things going on. Exactly, I would like for Dr. Shephard to discuss for a minute, should you get the vaccine, and what's the big benefit of that, getting the vaccine, and what about side effects?
Yes, you should get the vaccine. In fact, in OBGYN, all of our Societies have acknowledged that pregnant women should get the vaccine, and there's no reason for anyone not to. So a lot of people have been concerned about getting the vaccine in pregnancy. There's nothing that we have found about the vaccine that should restrict anyone from getting it. In fact, just as we admonish patients to get the flu vaccine, we're also admonishing them to get the COVID vaccine. And I think when people understand the technology behind it, as was mentioned before, we as professionals, health professionals, can appreciate why it came to market sooner than other vaccines would have. And the fact that we have all taken it means that obviously we believe in it to protect our patients, to protect ourselves, but to protect our patients as well. And I was sharing with Dr. Dagogo-Jack that I had my first dose, I believe, in December. The second dose, I actually had it on my birthday. So that was my birthday present to me, to have my second dose of the COVID vaccine. And I had absolutely no problems. I usually get soreness in my arm after getting the flu shot, and that was pretty much the same thing. And it was maybe a little sorer. I do have some colleagues that had some milder general malaise, symptoms that lasted for about 24 hours. But, you know, it was nothing compared to the benefit that we had from getting the vaccine.
Dr. Washington, did you notice any side effects?
I did have some general achiness after I received, more so after I received the second vaccine, and I just took Tylenol or ibuprofen. I feel the same way as Dr. Shephard. You know, those side effects are very mild compared to what we have seen in patients that actually have COVID. And to me, that was my body saying that, hey, I am making an immune response. And so I was actually happy to receive, have those side effects. That made me feel like I knew it was working. I've had some colleagues that said that they got the vaccine and they didn't have any side effects. And they were saying, I wonder if it really works. So it was very comforting to me. I know that there are a lot of people out there who are very concerned about side effects of this vaccine. I did chronicle that on my social media page that is open to the public. I did daily videos for about a week talking about side effects after both doses of the COVID vaccine. And I've gotten a lot of feedback, a lot of people, friends, family, other essential workers have reached out to me and said that, you know, I'm so glad that you did that. It really made me feel more comfortable about it. And as a result, they've signed up to receive the vaccine. And so that's really the reason why we do what we do. That's the reason why we're here today, to talk about the COVID vaccine, to tell you that COVID is still a threat. I've actually had more people here in the past 2 weeks that have called me or messaged me and told me that they've had a loved one die from COVID than I have throughout this entire pandemic. And so it's still a threat. You know, we are very confident in the vaccine, and we encourage everyone to receive the vaccine once it is available to you.
Dr. Dagogo-Jack, what about your side effects?
Oh, negligible. I didn't even feel pain the first time, no soreness, and I was wondering whether people had given me a placebo. But I know that the stage of placebo is over. The compassionate emergency use has been approved by the FDA, so they should be giving us the real stuff. That evening of my first shot, I was able to join my colleagues at the gym and played 2 hours of vigorous racquetball. So my health was not affected. Then I got the second shot about 3 weeks after. This is a Pfizer product. And then I got a little soreness in my left upper arm that went away the next day. I didn't even need to take Tylenol or ibuprofen or any pain medication. And I've been feeling fine ever since. I joined my colleagues in really talking up this vaccine. This is like a shield of armor before going into battle. You have your protective gear, bulletproof vests, and we would drop their bulletproof vests before going to face bullets at war. We're at war really with this thing we can't see, and it is devastating our people. And we have this antidote to it, we should go get immunized to
Right.
give ourselves a fighting chance. It does not mean you won't get it, just like the flu shot, but it will emasculate, it will weaken the impact of the virus when you get it, because your body's soldiers, the immune system, are already geared up. They know what it looks like, and as soon as it rears its ugly head into your system, they zap it up and limit the
Dr. Wofford, what about you and your side effects?
I had injection site pain that lasted maybe 2 days the first time, a little bit worse than a flu shot. But after the second one, I took a dose of Tylenol just to preemptively, but it lasted less than about 24 hours. So it's much better.
Right.
So, like everybody said, I think the side effects, you hear colleagues do have more side effects sometimes, but the side effects are very small compared to the benefits.
Right. And of course, men are better at complaining about the side effects than ladies are. So we're going to complain. Now, I'm going to open this up. Whoever wants to take this question, please raise your hand and we'll acknowledge you. After you get vaccinated, does that mean that you can quit wearing a mask and quit social distancing? I know the answer, but I want someone else to talk about this. After you get vaccinated, are you totally immune and you can go about your life normally? What's the answer to that? And I've got a feeling Dr. Washington knows what this is about.
I can take that question. So it's very important that after we receive the COVID vaccine, after anyone receives the COVID vaccine, that you still continue to wear a mask and practice social distancing and wash your hands. The reason being is that, after you get that injection, you're not automatically immune. Your body has to build an immune response. And really, right now, they're saying that between 2 to 4 weeks after your second dose of the COVID vaccine, that you would be considered to be fully immunized. And so, even once you are fully immunized, it's still important that you wear a mask because you're protecting others. Just because your body won't be affected by severe COVID-19 disease does not mean that you cannot harbor the virus like in your nasal cavity and spread to others. So we are still very much on a protection strategy where we want to protect others in the community who may not have had the opportunity to receive their COVID vaccine yet.
Dr. Shephard, would you like to chime in on that about the importance of continuing to, even though you may have asymptomatic COVID-19 after your vaccine, but do you find that, do you give that advice to your patients also?
Yes, I think it's still important for us to social distance, and for the very reasons that Dr. Washington gave. Nothing is 100%, especially in OBGYN, you know that. So we still say that those measures are very important. And the whole concept of herd immunity, we've got to get it to the point where the virus has no place to go, essentially. And we're not there yet. And we need to protect each other. Again, I may not have those symptoms, but it may be all up in here and you are not protected. The whole mask and social distancing is not just to protect myself, but to protect others. And with the designer masks that are coming out these days, I think it's kind of popular to wear masks.
It is.
And so I think we should continue that. It's definitely, that's what is recommended. And until those recommendations change, we need to abide by them and encourage our patients, our colleagues, our family, and everyone we know to just stick by the guidelines.
Well, Dr. Dagogo-Jack, I'm going to give you can have the final word here, especially just 30 seconds about the variants and how important it is for us to all get vaccinated right away to stop this variant vaccine of COVID-19.
Thank you for bringing that up. The variants, the two variants we know now and more to follow, are the UK variant and the South African variant. They have been described as more transmissible. So if a carrier sneezed into a crowd, more people will pick it up and get sick from it than the original form of the virus. Fortunately, this variant is not yet taking hold in our land. A few cases have been reported, but traveling to UK or South Africa is not required. So it is mutating here in the US on its own. The cases found in South Carolina were in people who never went anywhere. So my advice is that we should aim to achieve rapidly herd immunity before these variants take hold and become the dominant forms. I fear for our people, the vulnerable populations, because if they are under-vaccinated, by the time the variants take hold, that predicts disaster for communities that are not yet immunized. So we should be pounding the pavement, banging on the doors to get admitted into the vaccination space and get vaccinated and get the second shot if you are taking the Moderna or Pfizer variants, or one shot for the new one that is in the horizon, so that we can stand ready and protected just in case some variation of the original virus that is more difficult to control looms up. We're ready to be protected.
I thank you, and I thank all of our participants. I know everyone has patience to see. You've taken time out of your busy schedule. Please listen to this message. Get vaccinated.
Yes.
Please do this. It is the best thing for you. It's the best thing for your family, for your church, for your social network. It is the thing you should be doing. So thank everybody for attending and for bringing this important message. And I'll let you all wave goodbye to the audience, because we really appreciate you listening. I'm Dr. George Flinn. We'll see you really soon, and we might have to bring this group together again for another show. Thank you again.
All right. Take care.
You're welcome.
Thank you.
Bye-bye. Thank you.
Thank you. Bye-bye.